Well, I think probably the very first thing that we did back in March when we began to react to the COVID-19 pandemic was that everybody started wearing masks all the time. We continue to do so, although I took mine off for my interview, both in the office as well as in the clinic. I think there are a couple changes that we talk about already being lasting ones. One is that we have learned how to connect virtually over Zoom across the world. And I think that ability will change the necessity for the amount of meetings that are happening. Just in the last 5 years, each year there have been more meetings that I have wanted to go to. And so I wonder if more of them will become virtual, like the ASCO 2020 in a couple weeks. And secondly, I wonder, a friend of mine on Twitter said this is another genie that's not going back in the bottle, which is telemedicine visits. We now know how to connect with our patients, both receiving standard of care therapies as well as on clinical trials, using the computer, just like you and I. It has eliminated a lot of travel. I can tell sick or not sick over the computer many times. Primary referring oncologists have been willing to do safety labs that otherwise protocol might have required a patient come all the way to Nashville to have performed. At Sarah Cannon, we have many patients who come from all over the country to participate in clinical research, and telemedicine has allowed patients not just in Nashville but everywhere to remain on study, to remain participating in clinical research trials. And I think that is a shared learning that we won't get rid of after the pandemic has quieted.